Hi, everybody. Happy Thursday. Welcome to Sanction Chat. I'm Amanda Hosenfeld, Learning and Development Coordinator for Compliance Line. And with me, as always, I have our Customer Support Specialist, Matt Kelly.
Hey, how's it going?
And if you tuned in this week just to hear Karen, I'm so sorry to disappoint you. Karen had an emergency and she's not going to be able to join us today, but we can never replace Karen on Sanction Chat, but we do have our special guest, the voice of SanctionCheck, Lucaya Brown. She's a SanctionCheck specialist. She's joining us today. Hi, Lucaya.
Hello.
Hello. I know this isn't your first time in Sanction Chat, but it's your first time in our special kind of edition of Sanction Chat. So we're happy to have you here.
I'm happy to be here.
So speaking of special editions, this is our very first special edition of Sanction Chat, and today we're going to be talking Sanction horror stories. So a very big thank you and welcome to our constant listeners, our regular Sanction Chat audience, but a very, very special welcome to anyone who took a flyer at the HCA conference, who found us on LinkedIn, or who we have sent GIF emails for the last 3 weeks to. We appreciate you being here. We hope you find this informative and entertaining, and we are glad that you are here. So we're going to run Sanction Chat a little bit differently. If you're a constant listener of ours, you know we usually open with a poll question. We're not going to do that this time. We're going to go straight into some information just because we have a lot of subject matter to get to. So a couple of housekeeping things. You know, normally we do take live questions during Sanction Chat. We are not going to do that today because we have just our limited hour and we have an extended audience. So we want to make sure that we get to every single story that we're going to cover. If you do have questions, we are absolutely happy to answer them. You can do one of two things. You can email them over to support@sanctioncheck.com, or in your webinar, you have a place for questions. You can input them, and we will compile all of the questions, answer them, and send out a document to everybody that attended. Also, a little bit of housekeeping. We do have 2 handouts available to you. One of those handouts contains the research links to the stories that we're going to be covering today, as well as targeted specifically to anybody that is new to Sanction Check or Sanction Chat, a absolute shameless Sanction Check promotional brochure if you're interested in our services after you hear us talk. So please go to your handout section of your webinar. If for some reason you can't access those, you are also welcome to email us at support@sanctioncheck.com, and we will get those to you. All right, last little thing, and then we're going to get into our stories. Today's subject matter is a little mature. We have pulled 3 stories to tell you today that are all pulled from public news sources or public information record databases. So we have not changed or altered names in any way. The information that we present to you is the information that we have available to us through the public forum. Because these are horror stories, they are going to contain mature content, and you may have some graphic details on your hands here. But ultimately, what we want to convey to you is, like all exclusionary review tools, Sanction Check is that. It's just a tool to help companies make informed decisions about their hiring or terminations. The stories we're going to present to you, we're not passing a judgment on the institutions. We're not doing anything like that. Again, the legal and risk departments of individual companies are the ones that make those decisions. And again, Sanction Check or whatever exclusionary review tool you use is there to help. So informational purposes only. Again, questions, please throw them in the question box or email them over. And with that, are we ready to get started?
We're ready.
We're ready. All right. So our first story today comes from, or starts in California, and we're going to tell the story of Dr. Larry Isaacs. So this is really a study in casting a wide net when you're doing exclusionary screenings. And we start in California in 2009. So Dr. Isaacs treats a woman that comes into the hospital complaining of abdominal pain. She comes in, she sees Dr. Isaacs. He fails to perform proper diagnostic tests and states that she has appendicitis. The thing about it is this woman didn't have an appendix. She had an appendectomy years ago, but he didn't do those tests, so he automatically said it's appendicitis. And when he goes in to perform his appendectomy, he removes a fallopian tube, thinking it was her appendix.
Oh, wow.
Yeah. So I guess I'm not a doctor. Do they look alike?
Do they look alike, maybe?
I don't know. So that was in May of 2009. In February 2010, the same woman goes back to the hospital complaining of additional abdominal pain. This time they do a CT scan.
And she gets him again.
She gets Dr. Isaacs again. Yes, wow. You're exactly right.
She wasn't feeling at all concerned.
I don't know. I don't know. The story didn't say whether she knew it was a fallopian tube that was removed. I don't know. So she gets Dr. Isaacs again, and they do CT scans, and it turns out that she's got 2 hernias, one in her abdomen and one in her pelvis. So I don't know if anybody knows anything about the way hernias are repaired, but that's when or what a hernia is. It's when an organ pushes through the muscle and into a different cavity in the body where it shouldn't be, and those are fixed through meshes. So a doctor will go in and they'll put a mesh to kind of contain that organ. If you are a doctor and you are listening today, I probably did not do that justice, but based on my very limited Google research, that is what a hernia surgery is. So Dr. Isaacs used the wrong size mesh and did not properly treat the same woman who he had improperly treated before. So 6 days later, she comes back and they show a hernia in the same area, and that indicates either the initial surgery was unsuccessful or there was an undiagnosed hernia that they didn't catch the last time.
Right.
So a few days later, an additional x-ray shows another hernia involving the small intestine. This one, Dr. Isaacs goes in and he repairs by removing part of the small intestine. And over the next few days, scans showed that Dr. Isaacs left a portion of her small intestine unconnected with, took a piece out, didn't connect the other 2 pieces.
Seems like a vital thing to miss.
I mean, it does seem like something that you would.
That's pretty important.
Right. So it caused an infection, and the patient ultimately sued Isaacs, received a settlement, but of course Isaacs didn't take any blame for it. Now, this was in 2010, and I don't know if you guys have any dealings with medical boards, but processes move very slowly when there's complaints against doctors. The California Medical Board, beg your pardon, accused Isaacs of gross negligence and repeated negligent acts and incompetence just in this case. And Isaacs ultimately admitted to inadequate record keeping only and agreed to surrender his California license. So in the meantime, what happened is that Isaacs moved to Louisiana.
Wait, I thought you were done.
No.
There's more.
There's more.
Okay.
There's a lot more.
All right.
Yeah. So Isaacs, in the meantime, has moved to Louisiana, gets a Louisiana medical license, began to work. And we actually found a newspaper article from the hospital kind of welcoming Dr. Isaacs as their new general surgery doctor. And in the article, it lists, among other things, his specialties as appendectomies and hernia repairs.
This would be the part where the deep narrator voice would come in and say, if they only knew.
Right, and in fact, those were not his specialties. So shortly after he started working Isaacs went to the Louisiana Medical Board and stated, and this is a quote, "A hospital in the state had suspended his privileges." And he told the medical board that Louisiana had, a hospital in Louisiana had suspended his privileges. No further details, didn't offer anything else. And the Louisiana Medical Board thought, maybe this needs to be investigated a little bit. And they did an investigation and ultimately accused Isaacs of, during a colon surgery for a patient in Louisiana, removing a healthy kidney from the patient.
As you do.
Right.
Well, yeah.
Is that
and it's an organ, so
Right.
I guess
it's
just.
I mean, it's no fallopian tube.
It's not a fallopian tube. That's true.
Isaacs denied the allegations of removing a healthy kidney, said it was unhealthy. After this, an additional woman dies after Isaacs removed a non-cancerous kidney during a surgery to remove a tumor from that kidney. So he was supposed to remove the tumor. He took the whole healthy kidney other than that tumor. So Isaacs asserted that no, that kidney needed to be removed. But ultimately, in 2013, Isaacs surrenders his Louisiana license and kind of as his swan song says, well, I'm moving to New York anyway. So he gives up his license. And I know what you're about to say, Lucaya. But no, this is not the end. He does, in fact, move to New York in 2013. He worked as the assistant director of trauma services in Middleton, New York. Now, during this time, and this is literally all the details we have on this, the New York Office of Professional Medical Conduct investigated allegations against Isaac twice with no action. So we don't know what those investigations concerned. Right. Nothing came from them. However, this is 2013, 2014. Remember, in 2016, California decided he surrendered his license to California.
Right.
Because of that surrendering of his license, New York Medical Board accused Isaacs of professional misconduct in California, and Isaacs voluntarily and permanently surrendered his New York license. So we are California surrendered, Louisiana surrendered, New York surrendered.
Okay.
And normally, this is where I would say, all right, let's take a breath, right? We are not at all done.
Right. Oh, no, we're not.
Right, we are not at all done. Isaacs has moved and continues as of November 2018 to be employed in the state of Ohio at
Whoa.
Yeah. You gonna stop me again?
I'm sorry.
That's
so
okay.
Sorry.
No, that's all right.
He's currently, like right now?
As of November 2018 was the last article written concerning these allegations.
Oh my gosh.
Yeah, so he is still employed, or was as of November 2018. Ohio did open investigations into the allegations in various states, but ultimately decided that he could keep his license. As we could probably expect, Isaacs denies any wrongdoing and defends his conduct in all of the states. And I think it's pretty valid to kind of go through kind of his defenses.
Right.
He says that.
I want to hear this.
Okay, yeah. Are you ready?
Yeah.
All right. You remember in California, the case where he didn't attach the intestine?
Yeah.
He said that he did, but the sutures broke down. But he also said that the medical board in California profits from fines, and so that if he were to fight these claims, he would continue to pay California. Additionally, he didn't feel like he would get a fair trial because the patient that with the detached intestine, she's Hispanic, and the population is also Hispanic and would be his jury pool.
Oh,
so he wouldn't get a fair trial. In Louisiana,
somebody
crazy.
else's.
Yeah,
It's always someone else's
it's an
fault.
excuse, right?
Yeah, a bunch of excuses.
He said in Louisiana he was warranted in removing the kidney, but he dictated the records incorrectly. So sort of like I said healthy, but I meant unhealthy, and it didn't connect. The hospital, he also said the hospital is treating him unfairly due to a contract dispute. He said additionally that the hospital's attorney was the nephew of the medical board's president. So that was a conflict of interest that was not in his favor. And he said in the second case of kidney removal in Louisiana, the one where the patient died, he said he acted appropriately. And even though he was sued and gave a settlement in that case, his malpractice insurance trust fund paid for it. So it wasn't really him that paid for it. So he's technically not at fault.
A lot of excuses.
Yeah, coming from that
One
Dr.
after
Isaacs.
the other. Just, wow.
So go ahead. Sorry, Matt. Go ahead.
So at this point, it's just a matter of time till he jumps to another state then?
Potentially. All the articles that we read said he maintains that he did nothing wrong, and he doesn't plan on going anywhere else than Ohio, and he's trying to live the rest of his life in peace. That's what he said.
Yeah.
So this is
Well, at least he's living, right?
unlike
Unlike
some of his patients.
Yes,
Correct.
Exactly.
So what conclusions can we take from this about exclusionary screening? So you've noticed, if you've been following kind of the display, that he's got investigations, if not licensure surrenders, in 4 states all around the country. So let's take Matt's kind of thought, well, he could just move somewhere else, right? Let's expand on that. Let's say that Dr. Isaacs or someone like Dr. Isaacs with multiple infractions in different states decides to set up a medical practice, let's say in Nebraska. Okay, so we suggest, or any exclusionary screening suggests that when you do exclusionary screening, you review the surrounding states, and that's pretty common, right? Mm-hmm. Just for example, our office is here in Charlotte, North Carolina. We're a stone's throw from South Carolina. A lot of people commute back and forth, and so we would kind of automatically include South Carolina in any North Carolina exclusionary screenings for this area. So let's say that happens here, and that just in case, if you're doing the exclusionary screening, you also check Kansas, you check Colorado and Wyoming and South Dakota and Iowa. And if you did that, you still would not pick up the sanctions in the system from California, Louisiana, New York, and Ohio. So we're going to go out and we're going to show you kind of what that looks like within SanctionCheck. If you will give me one moment while I get logged in. When you do exclusionary screening, let's see, Larry Isaacs, let's take a look at his exclusionary screening results. And here we have exclusionary screening misconduct and discipline in New York, as well as a suspended provider list in California. So again, this is a real study in casting a wide net when you are doing exclusionary screenings. And again, SanctionCheck or whatever exclusionary tool you use is a tool to aid you in hiring and termination decisions, but this can give you the grounds for good research.
Yes.
Let's say you are in Nebraska and you open up, I'd say, I would want to know what happened in New York and what happened in California before I made a hiring or termination decision.
So again, to reiterate your point, if you're just doing a search in the states around you, you wind up missing. Because for whatever reason, he didn't wind up in the national databases.
Right.
Yeah.
He's only sitting on the state. So I could definitely understand why you would want to consider like expanding your search from there then.
Yeah.
I agree.
Do your due diligence. And if you are a user of SanctionCheck or check with your account manager or go into your system to see what databases you do have access to or you have subscribed to. And if you are not a SanctionCheck user, check with your tool, however you communicate with them, to make sure that you have access to the subscription list that you need to make informed decisions.
And for all our SanctionCheck users that are listening to this, if you want to know which ones you do and you don't have for databases, send us a question over at support@sanctioncheck.com. There's a report that you can run that will show you what databases you do have and which ones you don't have. That way you can know if you need to tailor your list to add or subtract any.
I think that'd be a really good idea.
Yeah, just to make informed decisions, right?
Right.
Yep.
All right. So that's Dr. Larry Mitchell-Isaacs. It's terrifying.
It's very terrible.
That's
I'm
terrifying.
scared to go to the doctor.
Right. No, please. That's my fallopian tube. Don't remove that.
Please.
All right. So our next story is I'm going to pass over to Lucaya.
All right. This is Dr. Mark Kanzler. In 1989, he enters an inpatient drug treatment program, and he returns to practice a few months after, his stay. In 1991, urinalysis was done, and a drug similar to morphine was found in his system, at which point the state filed an emergency suspension of his license. He did appear before the board, and he agreed to attend a state-sponsored program for impaired health professionals, and he agreed to submit to random urine screenings. After paying a fine and a stint in the drug rehabilitation program, he did continue to practice without incident for the rest of the 1990s. So
Okay,
that's
good. Yeah, good.
We're okay
All
right
done.
now. Little hiccup,
Lucaya, that was not scary at all.
It's okay, a little hiccup.
Not
Okay.
terrifying.
Okay, so then we go to December of 2003. He's actually named by the Sun Centennial as one of the biggest prescribers of controlled drugs in the state. In October of 2006, John Neckarauer dies. In a later lawsuit, it's determined that Kanzler, he was actually accused of negligence in overprescribing as a cause of death. We thought we were okay, but we're not.
We're not.
Okay. We're not okay.
It's obviously very poignant today with the current
Opioid
crisis.
crisis.
It's a very big deal, very big deal. And they did do an autopsy, and it did show that the amount of drugs in his system was 2 to 3 times the level that would be toxic.
Toxic?
Toxic.
Okay.
Okay. So we're going to keep going.
Oh, we're not done.
No, we're not
Okay.
done. November of 2007, Kanzler agreed to a 1-year suspension. However, he negotiated that down to a 1-month suspension. Again,
For a
someone has
man's
died.
life.
Yes, he's
Right.
died. But he was able to get that negotiated down to a 1-month suspension. In January of 2008, the Florida Board of Osteopathic Medicine placed him on probation with indirect supervision due to Department of Health charges of illegal prescribing for 6 patients.
I'm sorry.
6.
I just swallowed some water. Six patients.
6 patients. Now, all of that said, between 1999 and 2011, he settles 4 medical malpractice suits. 3, go ahead.
Sorry, I just want to
No,
clarify.
you're
That's
fine.
not like cases were filed. That's he settled.
He settled.
Okay.
Yes.
So he said,
Yes.
I'm guilty.
He said it. Yes.
Here's money.
Well, I don't know if you're like maybe he didn't admit
he
wrongdoing,
probably
but
didn't
like
admit wrongdoing, but
okay.
he admitted to doing something. He knew that he was wrong.
Okay.
Basically. So three of those 4, it was for over prescribing painkillers and causing overdoses. Okay, so this is how much medicine he's just throwing out there.
Wow.
I don't know if it's he's taking the pad home and somebody's giving a call up, hey, I have a headache,
don't feel good.
yeah, toothache, I don't
Stubbed
know.
my toe.
Yeah, stumped my toe or something like that, I'm not sure. It does not stop there, In June of 2013, a woman by the name of Margaret Moraz died at his clinic during an experimental stem cell procedure. Apparently, she suffered a seizure during the procedure. Her husband called 911. However, Chancellor refused to speak with the dispatcher. He did not want to get on the phone. I mean, she's having a seizure. She's clearly in need of help. He doesn't want to give it to her.
So my husband's a 911 dispatcher, and I would hear that story every day for the rest of my life.
Mm-hmm.
That's insane.
Yeah. His assistant actually told the dispatcher not to come, but they did come anyway. But get this, when they got there, the doors to the clinic were locked.
Like there was nobody there?
No,
or
they were still in there. The doors were locked.
Did they refuse to just let them in?
Yes.
Wow.
The doors were locked. Okay.
Oh my gosh.
Yes. Chancellor did not send the body to be autopsied. He did not notify the state that she had died in his care. He did not mention her death when recording her visit. And he didn't. He actually said that he gave her a shot and sent her home.
When she was in the clinic?
Yes. He according to him, he was not performing any type of procedure. He gave her a shot and sent her home.
That's legitimately terrifying.
Yes, it really is. So charges are filed in 2 separate cases for not properly documenting patient visits between 2014 and 2016.
So just exactly what happened with Miss Moraz.
Yes.
Okay.
Yes. And ultimately in 2017, Chancellor did surrender his license voluntarily. However, this was 4 years after Margaret Moraz's death. So he was able to.
He continued to practice
for 4 years after she died.
He continued making money.
Yes, he continued making money. I'm sorry, guys. It's
upsetting. Like it's really scary.
It's really scary to me.
That's the reason we called this episode Sanction Horror Stories.
And it's the truth.
So let's take a look at within SanctionCheck the tool.
Yeah.
What his a search would bring us about Mark Chancellor.
And this all happened in Florida.
So when we place Mark Chancellor into our system, he was sanctioned 13 times.
Yep.
By the state of Florida. And I want you to take particular notice of these dates that go all the way back to 1991, like to the original issues of state licensure suspension.
That's, I don't know. I don't understand.
We see occasionally where a sanction might be doubled or even tripled sometimes because of there might be an additional date entered for it. Or some other bit of information that leads to there being an additional entry form. I don't think I've ever seen somebody with this many different entries for one state.
I have not.
Right. So again, if this were somebody that applied to work at your facility or with your patients, this is SanctionCheck or whatever exclusionary tool you use is a good recommendation or a good source of information rather to say, let me either research this a little bit more. These are questions that I could ask the candidate, or is this a risk that I'm willing to take in my facility?
Right. I mean, people died.
Yeah. Yes.
Yeah.
In ways that were potentially preventable.
Yes.
All you had to do was prescribe smaller doses.
And let dispatcher and let help it.
Right. That could have saved her. Her life could have been saved.
It could have.
Oh, well, that story is horrible.
Yeah.
Thanks for sharing that, Lucaya. That's horrid.
Yes.
And all right, our last story then is we're going to pass it over to Matt, who is going to tell us the story of Dr. Yvon Nazaire.
Thank you.
Sure.
So, Dr. Yvon Nazaire. Now, I'm going to start up front with as this is a study in casting a wide net and reviewing sanctions, one thing I'd like to mention is very similar to the other cases, he only showed up on one state board in New York. But the other thing too was the person who actually did the background search on it. He just did a very cursory look over it. He mentions now in this case he had four deaths in New York, and so let's go ahead and get into this, and I'll go over to why that's significant. Okay. So Amanda, if you'll
sure.
Up the first slide. All right, so he got his degree with the State University in Haiti in 1985. And from there, he would go to New York, Interfaith Medical Center in Brooklyn, from 89 to 92. And then later he would get his license to practice medicine in New York in 93. From there, he served in a couple different positions until 2003, when he lost his employment at Kingsbrook Jewish Medical Center in New York for failing to get his certification in emergency medicine.
So he was an emergency room doctor
yes.
that didn't have or was unable to.
Correct, and that's what would lead to his, the ER is what would lead to his censure and reprimand, and in the next year, as well as his probation, because during his time there, he had 5 different medical malpractice cases brought against him. 5, 4 of which led to deaths.
Oh.
He was charged with 5 counts of practicing with gross negligence on a particular occasion, practicing with gross incompetence on a particular occasion, practicing with negligence on more than one occasion, practicing with incompetence on more than one occasion, and finally, failure to maintain records. Now, one of these cases in particular was somebody who came in with chest pain and vomiting, and he was prescribed antihistamines. And
for chest pains?
For chest pains?
For chest pains and vomiting. He was
okay. So
prescribed.
What does that have?
Lucaya.
What?
You. I mean, I don't know. You might be a doctor.
No, I'm
not a doctor.
I'm
okay.
not a doctor.
Is that a normal?
I don't think so.
Course of treatment?
I don't think so.
Antihistamines for chest.
No.
Chest pains
never
and
heard
vomiting.
of it.
Chest pains and vomiting.
Not just chest pains, but I mean that is the big one. But
right. Okay.
Neither one of them. I mean that doesn't make sense.
And so a day later, the man who was 28 years old died of a heart attack.
So it wasn't like sinus related. It was
or
a
allergies
heart attack.
Yeah.
Yes, it was. I believe it was a pulmonary embolism, is what they said. I might be getting my medical terms incorrect, but that would be because I am not a doctor
yes,
myself.
Right. We're not a doctor.
I feel like after all this research, we could potentially be
Possibly.
doctors.
Probably
and then
not,
end up
no, probably not.
End up on the list.
Right, we'd be on the list.
Okay, so he is given probation. He has to practice while being monitored, and he serves a year of this. But then let me bring up my dates here. So in 2006, the Georgia Composite Medical Board grants him a medical license. Now, normally what would happen at this point is they would give him a matching probationary status to represent what happened to him in New York. But he lied on his records about the $3 million malpractice suit that he had paid out in New York. And then he lied on his employment records as well. He stated that he was working in 3 different ERs, but it really turned out that he'd been unemployed for a number of years during that bankruptcy.
Okay, so just so that I'm clear, if you're sanctioned in New York,
mm-hmm.
if you for some reason move to Georgia, Georgia will mirror that sanction in Georgia.
If they know about it.
And in this case, he did not give that information.
He was required to be upfront with that, give him that information, and he didn't. And so they didn't know that about his sanction. I'm sure there could be something said about, they probably should have researched.
Exclusionary screening.
Right.
So he is hired in August of 2006 by Georgia Correctional Healthcare as the medical director at Pulaski State Prison in Hawkinsville. Later in 2011, he also assumed the medical director position at Emmanuel Women's Facility in Swainsboro. Now, he worked there for 9 years, and he was suspected of being involved directly in the deaths of 9 other individuals in the prison system.
Prison system.
Yes. Later, statistics came out, and he had 15 inmates die during his time there. Some of them were natural causes. It's not like every one of these was directly caused by him. But
so it wasn't like he intentionally murdered people. It wasn't that kind of.
Yes. And
not all of them.
A later investigation.
I'm sorry. I don't know. This is not.
It's cool. This is
really
an insane story. Yeah.
Okay, go ahead.
And a later investigation did discover that specifically 2 of the cases, the deaths were attributed to him providing substandard care to those women.
Okay.
So in some of these cases too, it was during this time, what was happening is he was actually getting commendations and raises from the prison system for saving money.
Please explain.
Yeah, can you explain that for me?
Well, he was saving lots of money by reducing the amount of external consultations that they would do for prisoners.
Okay, because they just had him as their doctor.
Well, and then his medical staff and everything. But
if they needed to go or get X-rays or anything extra,
if they needed to get a consultation on a particular X-ray, they would actually have to pay somebody outside the prison to provide a consultation on that. So when he came in, he started canceling these.
Oh man.
Yes, he canceled far more than he approved.
Can you imagine being a prisoner with a health condition like that? What choices do you have?
There are no choices.
Yes.
It starts with him and it ends with him.
One of the cases, Mitzi Butler, who had an X-ray consultation denied for severe abdominal pain. She later had to have emergency surgery, and it was revealed that her appendix had essentially dissolved.
I've heard of them bursting, like an appendix bursting. I didn't know that a appendix could dissolve.
I've never heard of that.
That's going to be a disgusting Google search that I do later.
Oh.
She spent a week in the hospital to recover from an infection.
Because he refused to get an outside consultation.
There was another woman. She actually lost blood flow to her to part of her intestines, which essentially meant a part of it had died. And and I'm sorry, this is very graphic, but she was vomiting feces.
Because part of her intestine had died.
Yes.
Because he refused to get
because of the substandard care that she was receiving.
He was being negligent.
And she later died.
So.
When Diane Blalock entered Georgia's prison system, she suffered from hepatitis C that could not be treated with medication. Her condition deteriorated there until at one point she was described as being yellow as a banana.
Oh my goodness.
This is horrible.
It's horrifying.
Peggy Leaf Walker was denied a consult with outside specialists despite having a distended stomach that made her appear pregnant. They wound up removing a gallon of 4.8 liters of fluid from her abdomen. She turned out to have cancer.
Oh.
He had at least two patients who died because they didn't get early enough detection of their cancer.
Of the cancer. Mm-hmm. They had symptoms, but
they say that at the very least they could have been made more comfortable if they could not have been actually treated for it.
And this is all so he wanted to save money to make himself look.
And it wasn't the deaths themselves that flagged this entire thing.
What flagged it?
Well, what flagged?
Like if you're not okay, so if you're a doctor at a prison and 15 to 20 of your.
Well, 5 of them actually died after they left the facility.
Okay.
So when they were either released or when they were sent to another facility, but they traced back the cause of their death to
that care during that time. Okay.
So what was the red flag?
Well, it was actually a story that AGC, a news organization in Georgia, ran and they were talking about sort of substandard doctors being brought into the prison system, and he was one of the doctors they featured. And then one of their investigative journalists started going further with it, and he started finding more and more troubling information. This eventually led to the internal review, where they found that in at least 2 cases, he had performed underperformed care for the he performed substandard care for the prisoners that led to their deaths. On top of that, they also found the inconsistencies with his work record and what was given to the Georgia Composite Medical Board. It was later found that that Dr. Edward Bailey, who originally did the background check for him, and this is the real kicker too, because at the time they would first bring doctors in temporarily, and when they brought these doctors in temporarily, they would not do background checks on them.
Even on a doctor?
Even on a doctor.
A doctor.
Any temp worker.
Like a medical doctor.
Any temporary doctor they brought in, they would assume that the hiring agency they went through performed the checks, but that those hiring agencies didn't have access to any of the databases that they would need for this. So nobody, one hand thought the other was taking care of it.
That is unacceptable.
So how, I mean, just about, apart from Nazaire, how many people flew under the radar?
Right.
Do you know what I mean?
Right.
Like because somebody else thought somebody else was handling it.
The policy was changed in 2015.
Okay, good.
Oh my
good.
gosh.
Mostly in relation to this case.
Because of Nazaire.
Now he was hired. He was brought in, hired permanently, and that's when they did the background check. Well, Dr. Edward Bailey knew something had happened in New York, and he had only briefly gone over 2 of the cases. He actually didn't know about the other 2 deaths, and he described it as just decisions that went awry. Judgment calls that went awry.
He said that of Nazaire's practice in New York.
Mm-hmm. And so he felt no trouble offering him a position. Some of the things people were saying about him before all this information came out too, a lot of it was in regards to how much money he was saving. It was said that he dropped the outside consult rate to a low number, thus keeping Pulaski below budget. He is saving the DOC so much money and goes above and beyond any other physician in the systems. This was written by somebody who was Betty Rogers, who is urging him to be given a raise. In fact, he wound up getting about another $5,000–6,000 beyond that by the time he was forced out of his position.
A raise for being negligent.
Well, they thought he was just a really good administrator.
Good at saving them money.
But the bottom line in that case is all about the money at that point. But
In the prison system,
that's how it sounds to me. And maybe he did that because they were in prison. I don't know. I'm not gonna speculate
Now,
I just know it's horrible.
it would be nice if that was the full end of it. If that was just
there's more?
The end.
Oh, there's more.
What do you mean?
There is more. So he never received sanctions from Georgia, because by the time they wrapped up their investigation into what happened, he had actually let his license lapse.
So we talked about that a little bit earlier about how investigations can take a long time. I said one of the cases that we researched said that it's normal investigation of a medical board takes about 9 months, and involved investigations can take years.
Yeah.
And so he let his lapse, and by the time they finished the investigation, they actually couldn't put any sanctions on him, because they can only sanction Georgia doctors that have active licenses. So when his license lapsed, they couldn't do anything anymore.
So if we were to search
Georgia, you would find nothing related to what happened in the Georgia prison system, and that is specifically because of how Georgia's system works.
Well, I know you said that they changed the laws concerning like temporary workers because of Nazaire. Do you know if they changed that?
There's nothing in any of the stories about them updating that.
Wow.
So, and actually at this time, Yvon Nazaire was actually applying for a medical license in New Jersey.
Excuse me?
Like
Yes.
current, like now?
Yes,
Right now?
it is listed as still pending on New Jersey state site.
Oh, wow.
Now, that said, there was a deposition recently involving one of the the lawsuits that was brought forward. In fact, about $5.5 million minimum has been spent between New York and Georgia in paying for his malpractice
Settling cases.
Mhm. But during the deposition, he mentioned that he would be working at a heart clinic. I'm sure there's a much more technical way to say that.
Cardiac
clinic.
Something.
That a colleague ran, and that he expected to get his license in New Jersey.
Oh, that is so scary.
Now it is thought, because of all the pressure that the AJC story has brought up and the investigations that came about, that it's very likely that he won't get his license there. It's been left pending for over a year now. And last I heard, it was still pending. I don't know if it currently is, but so at least maybe he won't get his license there in New Jersey.
He doesn't need his license.
So just to kind of put a bow is not the right thing that I want to put on top of this, but of the 3 cases that we covered today, one is not at all practicing, one is trying to practice, and one is actively practicing.
Yes.
What conclusions can we bring from Nazaire's case?
Well, first there's the need to cast a wider net. If just for the fact that, if you were to search him in New Jersey right now, if they were just doing the state over policy, they should hopefully catch him with the New York sanctions. But if he was applying anywhere else, or if they were just practicing where a hospital was practicing the policy of just doing their states, they might not find him, and he could, if it wasn't for the AJC story, he could be working right now. So it's definitely cast as wide a net as possible. And another takeaway is just how much damage just one person can do. Look at all the deaths that they've traced back to him in the 9 years he was with Georgia. Just one person slipping through, one bad actor can lead to countless deaths.
Yeah.
The other part of that too would be, if there is a sanction, make sure you understand what it is. In this case, I think the saddest part about all this is Dr. Edward Bailey knew he had something against him in New York, and he felt he had done enough research by just, I don't want to say he just glanced over it, because I don't know exactly what he did there, but during the deposition, he didn't know about 2 of the 4 deaths. As I said before, I was going to come back to when he reviewed it, he said during his deposition that he only knew of 2 of the 4 deaths.
But he still knew of deaths.
He knew it, yeah.
Didn't continue to
He described it as it was a judgment call that went awry. He didn't see a pattern in it yet, so he felt that in good faith he could hire Dr. Yvon Nazaire.
Wow. So you did send me a video, Matt, of the deposition, and I will put that in the questions.
And that is of Dr. Edward Bailey describing his process of hiring Dr. Yvon Nazaire. There's actually another one. It's a deposition of Dr. Yvon Nazaire. I didn't include the link with it, but I would recommend viewing that as well. He doesn't seem to think he has done anything wrong from just watching that.
I think we can put the link to that, and because this entire presentation we're going to put up on our YouTube channel, right? So if you don't have access to our internal Go to Stage channel, you'll still have access to this presentation in the future. We can link to those 2 videos, I think, in the comments, right? That's something that I hear YouTubers say that they can do when I watch YouTube videos. So we can do that. They are interesting. I watched the Bailey one, and it's a deposition, right? It's just a video of him at a table, but it's eye-opening, kind of maybe the unconcern What is that a word? Like the disconcern? I don't know that that's a word either.
I don't think
The concernlessness. Lucaya, stop laughing at me.
Okay,
This is a very serious matter.
I would recommend watching the one that he actually did.
Nazaire did?
Nazaire, yeah. Just to see just how calm he is about the whole thing. So he states that he had no idea that there was an investigation or that it was recommended that he never be allowed to practice in the state of Georgia again. Yeah, he claimed that as far as he knew, his license in both New York and Georgia were both still good. So
I think that's what gets me. Like, I know these doctors did not mean to do what they did. They didn't seek these individuals out and say,
it wasn't like a serial killer kind of thing. Yeah, right. These are victims of mine.
Right. But you kept going. If you're taking the wrong organ out, maybe you don't need to be a doctor.
Mm-hmm.
Do you know what I mean? If you don't know the difference between, or if you don't know that someone doesn't have an appendix, maybe you don't need to be a doctor. So let's just, cut it off here and maybe, I don't know, choose another profession.
I mean, apparently 4 deaths in New York wasn't enough for Dr.
I just don't understand that.
So, I mean, I think this is a good opportunity as we kind of wrap things up here to say that we did a ton of research. All of us did. We looked through probably 100 altogether cases to find ones for you guys that met kind of our standards for presenting. And I have never been so aware of kind of some loopholes. Evidently, some of the things that we found out, if you voluntarily surrender your license in states, sometimes it won't show up in the databases because it was a voluntary, not a mandatory.
So you're not sanctioned.
Correct, even on the state level,
yeah.
Right?
Or if your license just happens to expire before they can finish their investigation,
you're not sanctioned.
Technically, it's crazy.
For me, the big takeaway was how many of these are just state database alone for whatever reason. And it may be because they were disciplinary cases, but they never wound up in the big federal databases.
Right.
And I know a lot of people rely on those big 4. I know they get nicknamed the big 4 by a lot of people for good reasons.
Right.
They seem to be the end all be all, but then you get cases like these where all 3 of these individuals, they don't appear on any of the main 4 federal databases.
Mm-hmm. That's startling.
It really is.
Startling. It's kind of one of those things that are like, oh, we're so happy to get this episode, because this was a very difficult episode to kind of produce and to research and to put together for you, and ending it is kind of like a big sigh of relief for us here at Sanction Chat, because it was very, very involved. We had a lot of meetings, we had a lot of research sessions, we had a lot of practices to make sure that we were giving you accurate information. We want to hear from you. If you have questions, of course, we already talked about the forums that you can give us questions. If you loved this show or these topics, if you did not at all like this show or these topics, if you would like more horror stories in the very, very, very distant future, please send us an email, support@sanctioncheck.com. We want to give a very special thank you to those of you that are joining us from outside of the Compliance Line Sanction Check family. We hope that you will take a look at our services, and we hope that you have been informed by this. We do, if you are outside of our Sanction Check family, we do this Sanction Chat podcast, or webinar rather. I always call it a podcast because it's the best way to describe it, right?
Yeah.
We do this webinar every the first and third Thursdays of every month for informational purposes. So that if that's a tipping point to hear our voices again, please consider Sanction Check as a service for you. To our constant listeners, thank you for the disruption and kind of our normal Sanction Chat format.
Slightly more lighthearted sanction chats that we
Yeah,
normally
Sanction
have.
Chat, we usually have a lot of fun. This one, it was still fun.
No.
It was more of a laughing through the graveyard.
Right,
very
that kind of
Yeah.
fun.
You had to laugh, otherwise you would start crying.
Yeah, which actually I'm going to admit that I did a couple times during resources because they're so horrible. But we would love to hear from you. Support@SanctionCheck.com. Also, if you're interested in our services, sales@SanctionCheck.com, and we will get you more information. But I think that's gonna do it for us today. Matt, do you have anything else?
I'd just like to reiterate a point Amanda brought up before, just that, if you, for any of our the outside listeners, if you decide that you do want to go with somebody else, just please take to heart some of the information we gave you today to help set your policies for how to do your sanction checks. Just finding these ones that were so spread out and so hard to the ones that just didn't wind up in the the big four.
Yeah, it's not a check the box kind of thing. This is very, very, very important.
Yes. So I hope we were at least a little bit helpful for what you do going forward.
Yeah, me too.
Lucaya, thank you so much.
I enjoyed being here with you all. I do not like the topic, but it was informative.
Definitely gonna need some brain bleach after
I
this.
am terrified to go to the doctor. I hope I don't have to have any surgeries anytime soon.
I know I'll probably be Googling that.
Yeah, I will be doing a lot of research.
Yeah, absolutely.
With whomever I need to see, if anyone. But
well, that aside, come back anytime to Sanction Chat. We love having you here.
Thank you very much.
You might not have guessed that Lucaya laughs at everything that we say. So it's good for your ego if you need somebody to laugh at a joke. All right, so we will be back in 2 weeks. Hopefully Karen will be back. Do we know what our next?
We have a topic, but honestly, we've been so focused on this one.
You are absolutely right. So check out, be on the lookout for an email about our next Sanction Chat, and we will send all of the questions and answers provided here, as well as a link to those videos. All right.
We'll send that out to everybody that showed up today.
Yep. All right, guys. Thank you so much for joining us. Have a great rest of your Thursday and a happy holiday weekend.
Happy holidays.
Bye.
Bye.